It's a huge problem in healthcare now where doctors don't spend enough time with the patients because of external pressures, because of limitations on what the insurance companies will reimburse. When I know in dentistry, the insurance companies, and I'm not exaggerating, are allowing the dentists, the amount they allow to be charged hasn't changed since like 2008. So it becomes unsustainable to do quality dental work and take the time to really do things properly. And if things aren't done, the amount of proper time put into it, but also using the best quality techniques, instrumentation, equipment, dental labs, when people have economic pressures to have to make ends meet running a practice, then something's got to give. And even if their intentions are good, there's going to be corners cut. The ironic thing is that patients sometimes think they need to go to someone who takes their insurance or is in network. Again, many of those doctors may be doing excellent work. I used to be in network with live insurance, but it becomes unsustainable. You think you're saving money by going in network, but you're better to go to someone who you trust and you know is going to do good work. Yeah, patients are put in a very difficult position by the insurance companies, and it's really not fair to the patients at all. The insurance companies, many of them allow, for example, $1,000 a year. They were allowing $1,000 a year 25 years ago. That doesn't get you very far today, unfortunately. And when patients think they can only do what their insurance is going to cover or allow, they end up hurting themselves. Because when you put off work that needs to be done, when you put off things that can be fixed easily now, trying to do things little by little and maximize your insurance and fix something 5 years from now, it might not be feasible, and it might end up, causing you more problems down the road. I'm concerned with my patients' overall health, and yeah, it's very frustrating with insurance when they dictate treatment. There's also times where the insurance companies will reject procedures because they're done on the same tooth on the same day. So for example, I can save a tooth. Somebody could break off an upper premolar or bicuspid, and I may have to do a gum surgery to expose enough tooth to save and then do a large filling or a crown. I can do that all at once, but the insurance companies will say, nope, can't do the gum surgery the same day as you fix a tooth. And I'll say, well, I just did. So how you tell them you can't? But it's all a game they play to minimize what they pay, and it's really a shame they get away with it, and it's not fair to the patients. Modern dental insurance is very misunderstood. Patients sort of see it as being similar to their medical insurance, and it's very, very different. With dental insurance, it's almost like a discount plan where it includes maybe your cleanings and exams, and you'll save some money up front on some fillings, but then your benefits run out and you're stuck paying for everything anyways. So what we offer as an alternative to patients, because traditional dental insurance is so frustrating and it's very limiting to what patients can take care of with their mouths, is we have the Stevenson Smiles membership plan. The patient pays a certain amount per year, and we have a rate for individual versus a couple versus family. That includes getting 2 cleanings with the hygienist, 2 hygiene visits, and your exams a year, your x-rays at those visits, a discount on all other dental. So it ends up saving patients money without the hassle of dealing with insurance companies. Another advantage of the Stevenson Smiles membership plan is that mostly covers procedures, for example, such as veneers that are considered a cosmetic procedure. So anything that's elective or cosmetic, insurance is going to reject, and it's not even something we submit to insurance because it won't be covered. It covers a much broader range of procedures that you can get the discount on versus insurance having to play the guessing game of is it covered or is it not. Being a dentist who can always think about the patients first and not having to think about insurance really frees the dentist and frees the patient once they understand it to look at their overall mouth, look at their desires and needs and overall health and address what needs to be done. They just need to understand that we don't make decisions for their health based on what insurance is going to dictate.